a big question in many people's minds is, why is it that for decades there has been a sort of a halt on these new developments around mental health medications and treatments?
As somebody that's just in a process of transitioning from government, I think that the psychedelics, I mean, we had this with cannabis as well. I mean, the problem always ends up being is when something has licit and illicit uses, for recreational and for medicinal uses, the line gets blurred, it gets caught in. The first interview, just as I was sort of coming into this new position, I was researching the first interview that I did on sort of MDMA assisted psychotherapy was in about 2010. And I remember I got my wrist slapped a little bit for sort of, talking about this. And the way I spoke about it, I literally said in my quote, I said, if randomized control studies are done, and if there's evidence that shows this is safe and effective, and if Health Canada approves it, and if international societies sort of bless it, then we might consider it, right? But even that was a controversial statement in 2010. So I just think, I think that we get mixed up with, the words licit and illicit, in the sense that there could be an illicit use of Gravol. I mean, if you give it to high school kids to get a buzz from the anticholinergic effect, and there's licit uses of cocaine if you're using it to freeze the eye or freeze the nose in surgery. So I think that we need to break away from some of that dichotomy. And what we're really trying to demonstrate here is the safety and efficacy of these substances. Think about, we've just gone through the vaccine trials. So in the same kind of sense, we're looking for things that work. We're looking for things that are safe. This is now being done in major university centers with ethic boards. And so we're really very, very strictly trying to do this. And part of it is to sort of, in some ways, it's the right way to do things, but it's also to convince the regulatory bodies that this is not sort of shady stuff around the corner. This is completely above board, and I think that's going to be the only way to have a lasting effect.
Yeah, I really agree, Rakesh, and I think that's why it's so important to do these studies in a very meticulous way, right, in a very scientific way, and to follow people, as long as we can, to also see the long-term effects, and so we can really examine, what are the long-term effects, both positive, and ask the questions, are there any negative effects? I think people will want to know that. And also really tracking, what happens both neurobiologically, but also on a bodily level. We know that trauma has a big effect on the inflammatory markers, for example. And so I think people will really be curious to see, can we change mind, brain, and body with these treatments? And how can we change them? And how long does it last?
Yeah, I think Ruth is touching on one of the most interesting aspects of this category of research, is the fact that the compounds of interest, psilocybin in this case, and other psychedelics, really are they address multiple systems. We think of them as primarily addressing the central nervous system and their sort of prime effect, but they are very much active in the GI system, the immune system, in inflammation response. So it's really kind of an interesting open question in this area of research as to how that then branches into other conditions or helps more in nuanced ways address the prime conditions of interest like PTSD, depression, etc.